We continue to recognize Breast Cancer Awareness Month by learning how your family history can be a factor. So we're glad to have Dr. Nancy Taft, the Breast Program Medical Director at Jupiter Medical Center. Can you first off, Dr. Taft, start by explaining what is a high-risk breast cancer program?
Well, I think first of all, when people have a family member that gets diagnosed with breast cancer, their next question is, well, what impact does that have on me? So they need to either see their physician to discuss that risk, or we at the Margaret W. Needham Breast Center, when the patient comes in, a lady comes in to get her mammogram, she fills out a questionnaire, and that information is reviewed by our breast imagers, and they look at that and their breast findings, and they calculate their risk. So once they're identified as being high risk, that helps to facilitate a counseling appointment with a genetic counselor.
You hear a lot about the BRCA1, BRCA2 gene mutation. Can you I know it's a little complicated, but can you sum that up for us?
Well, there's two genes, BRCA1 and 2, as you said. You can have mutations. Some of them are pathogenic, meaning they're harmful, and some are not. So that's why you really need to be in the hands of a genetic counselor and a breast specialist. You're not only at increased risk of breast cancer, but also ovarian cancer, and then there's other cancers. So it's not limited to just breast. And there's a lot of things that we can do, high-risk screening and more frequent exams and more intense screening to help identify things early. And we can also talk to you about like lifestyle changes, things you can do to minimize your own risk.
I thought you just used a really interesting analogy when we were talking during the commercial. The education is out there, the awareness is out there, but when someone is diagnosed, you said people kind of treat their diagnosis like a salad bar.
They do. So, you know, the public is much more aware with all this information, and there's a real trend towards holistic health. And so a lot of times ladies decide, well, I want this chemo, but I don't want that chemo, and I don't want this surgery, and I don't want radiation. So a lot of times they want to pick and choose. But I would say it's really a multidisciplinary approach. And you really, whatever treatment that we tell you that we need, it's based on science.
Sure.
And it's for your best
outcome. Listen to your doctor.
Yeah, absolutely.
Genetic testing kits, are those fairly predictable?
So those are direct to consumer genetic marketing testing, and I'm a big proponent on these are not diagnostic tests. They may tell you that you may be a little higher risk, but they don't look at all the genes and they don't look at all the areas of mutation. So you just get a small sampling.
So not very reliable.
No, they're interesting. They promote conversation. But as far as being diagnostic that you have a genetic abnormality, they certainly aren't able to do that.
So be careful of those. I know we're running out of time, but can you talk a little bit about what's on the horizon for early detection that's just so important, catching it right at the beginning?
Well, in all kinds of industry, they're really stepping up to the plate here. So they're looking at all kinds of different types of imaging. There's a blood test that they're looking at doing. A bunch of researchers at Johns Hopkins are trying to do a blood test that every year when you go to see your doctor to get your blood pressure checked, you get a blood test. So that's still
that would be convenient.
It would be really nice, but it's still in clinical trial, but I think it's coming.
All right. Dr. Taft, thanks for your time today.
Thank you.
We appreciate it.